Hi everyone, welcome back to my YouTube channel. Today we are going to talk about palatine bone, and here at the side you can see the diagrammatic representation of norma bizalis that with the highlighted part that is palatine bone. So let's start our topic with introduction. Palatine bones are two L-shaped pair bones located at the back of nasal cavity. Despite their small size, they have a big job helping to form the posterior part of hard palate, lateral wall of nasal cavity, and the floor and small part of medial wall of orbit. Their location and multiple contribution to facial structure make them key players in breathing, speech, chewing, and orbital stability. Talking about structure and anatomy. Each palatine bone has two plates and three processes, creating a structural bridge between the oral, nasal, and orbital cavities. First, we will talk about its plates. It has horizontal plate and perpendicular plate that is also called as vertical plate. Then it has processes that are pyramidal process and orbital process and sphenoidal processes. Now let's talk about its horizontal plate. It forms the posterior one-third of hard palate. It joins its partner at the median palatine suture. It articulates anteriorly with the palatine process of maxilla. Then we will talk about perpendicular plate or vertical plate of palatine bone. It extends vertically to form part of lateral wall of nasal cavity. It has groove and opening for neurovascular bundles. Then we will talk about its processes that include pyramidal process that project posteriorly and laterally to form the junction of horizontal and perpendicular plate. It fits into the pterygoid fossa between the medial and lateral pterygoid plates of sphenoid bone. Then it has orbital process that extend into the orbital floor. It contributes to the floor of eye socket sitting near the back of orbit. Then it has sphenoid process that extends superiorly to articulate with the sphenoid bone. It helps form the roof of nasal cavity. Now let's talk about foramina of ethmoid bone. It has greater and lesser palatine foramina that are opening located on the posterior hard palate for nerves and blood vessels that are branches of maxillary nerve and arteries supplying the oral cavity. It has palatine foramen that is formed partially by palatine bone. It is gateway between the nasal cavity and pterygopalatine fossa for vital arteries and nerves. Now let's talk about articulations of palatine bone. Each palatine bone articulated with 6 bones. They include sphenoid bone, ethmoid bone, maxilla, inferior nasal conchae, vomer, and opposite palatine bone. So they are the 6 articulations of every palatine bone. Now let's talk about functional significance of palatine bone, speech and mastication, as it forms part of hard palate, creating a rigid roof for the oral cavity. Respiration, as it shares the nasal passageway. Vision spore, as it contributes to orbital integrity. Pathway for nerves and vessels, as it has foramina that provide access for major neurovascular structure. Now let's talk about clinical significance. First is cleft palate. It can involve failure of fusion between the palatine bone or with the maxilla. Palatine torus, that is a benign bony growth along the midline of hard palate that sometimes involve the palatine bone. Third clinical significance is surgical access. Knowledge of palatine anatomy is critical in sinus surgeries, cleft repair, and nerve block, like the greater palatine nerve block that is used in dentistry. Now let's talk about conclusion of this lecture video. Palatine bone may be hide in depths of facial skeleton, but it's unsung hero, reinforcing your face from 3 sides while supporting speech, swallowing, breathing, and sight. A perfect example of anatomical elegance packed into a deceptively small structure. And this was all about palatine bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.